triads. Triads in surgery. So we're looking at some important ones. So firstly, the Borchards triad. It is in case of the gastric volvulus. Okay. And what are the components? Components include the epigastric pain. Next, it also includes the inability to vomit. Next, it also includes the inability to pass a nasogastric tube. Then we look at the next one. We look at the Cushing Triad. So the Cushing Triad, it is seen in case of the intracranial hypertension, IC hypertension. And what are the components? Components, it includes the hypertension, it includes the bradycardia, and as well as the irregular respiration. Then we move on to the Dieulafoy's triad. So Dieulafoy's triad, it is in case of the acute appendicitis. And the triad components, it includes hypersensitivity of the skin. Then reflex muscle contraction, as well as there is the tenderness. There is tenderness at the McBurney's point. Okay. Then we move on to the Gasia Triad. So Gasia Triad, the components, it includes the Dupuytren's contracture plus the retroperitoneal fibrosis and the Peyronie's disease of the penis. Next, we move on to the Hutchinson Triad. So Hutchinson Triad, it is seen in congenital syphilis. So what are the components? The components include the presence of the Hutchinson's teeth. Okay. And next, it is nothing but a notched upper incisors. And along with Hutchinson's teeth, there is interstitial keratitis. And next, there is also the nerve deafness. Next, there is the Mackler's triad. So this Mackler's triad is nothing but it is a Borhave syndrome. And the features it includes is the thoracic pain. Then there is also vomiting. And there is the cervical subcutaneous emphysema. Next, we look at the Quincke's triad. So Quincke's triad is seen in case of the hemophilia. So in hemophilia, there is gastrointestinal hemorrhage, and there is a biliary colic as well as jaundice. Next, we look at the regular triad. So in regular triad, there is a small bowel obstruction and there is a pneumobilia as well as ectopic gallstone. Next, we look at the Saint Triad. So Saint Triad, the components it includes the hiatus hernia, next the gallstones as well as the colonic diverticulus. Then we move on to the Tilock Triad. So Tilock Triad is nothing but it's seen in the mesenteric cyst. And what are the components it includes? There is soft flung to end swelling of the umbilical region. Soft swelling of umbilical region, and there is a freely mobile which is perpendicular to mesentery. Now what is the third component of the Tilock Triad? So the first two components we saw it's a fulminant swelling of the umbilical region, and then we saw it's perpendicular, and next it is there is a zone of resonance. There is resonance all around. And next we move on to the Trotter Triad. So what is Trotter Triad? It is nothing but a nasopharyngeal carcinoma. And what are the components? Components include the conductive hearing loss, and there is immobility. This is of the homolateral soft palate, and the trigeminal neuralgia. Next we move on to the Virous Triad. So Virous Triad is used in case of the thrombosis. So the components include there is hypercoagulability along with the stasis and the endothelial injury. Then we move on to lastly the Whipple's Triad. Insulinoma. And what are the components of the triad? It includes the symptoms of hypoglycemia along with the serum glucose, and this is less than 50, and along with the symptomatic relief on the ingestion of glucose.
Hello everyone, this is Dr. Hub. Now let me tell you our story. Running with us, we are sure you will reach your destination with ease.